Jess, my name is Sam. Can you tell me what's wrong today?
I just had this pain. I think it's my migraine.
Can you tell me where the pain is at the moment?
The right side of my head.
And has this happened before?
Yeah, I had a migraine like 3 months ago.
And is the location of the pain today, is it the same as where it was before?
Yeah, it's the same side as well.
Okay. And can you tell me when the pain started?
It's like an hour ago.
And did it come on slowly or rapidly?
Slowly.
Track the pain for me.
It's like this throbbing pain. It's
On a scale of 0 to 10, 10 being the worst pain you've ever felt, 0 being no pain at all, can you give this pain a number?
I'd say about an 8.
About an 8? Okay. And are you experiencing any nausea or vomiting with your headache?
Nah.
Are you experiencing any neck stiffness?
I don't think so.
Oh, okay. Is there a hyper palpate of your neck against your face? Okay. So I'm checking to see whether there's any pain or neck stiffness, because that can be a sign of meningitis of a headache. And also, I'm trying to rule out whether sinusitis or temporal iritis is present. So there wasn't any pain where I was palpating?
No.
Okay, that's good. And are you experiencing a fever?
No.
Are you experiencing any hearing loss?
No.
Okay. Any ringing in your ears?
No.
Any visual disturbances?
No.
Do you feel dizzy or that the room is spinning?
No, I just had sort of these like spotting when the migraine first started.
Okay. And have you got rashes anywhere?
No.
Is there a look at your arms? Okay. So I'm looking out for any non-blanching purpura or petechiae, which can be a sign of meningococcal septicemia. Any other symptoms that you're experiencing?
No.
Is there anything that makes your migraine worse?
Loud noises and bright lights.
Okay. Is there anything that makes it better?
Like these painkillers that the GP gave me last time worked pretty well.
Okay. And what were you doing before the pain started?
I was trying to study, yeah.
Okay. Did you have any recent accidents or trauma before the headache started?
No.
Okay. So now we'll be doing a neurological assessment. And is it alright if I shine a light in your eyes to have a look at your pupils? Okay. So I'm checking to see whether pupils are equal and reactive to light and accommodating, which they are. So that's good. Can I get you to follow my finger? Just keep your head still, okay? Okay, that's good. Okay. That's good. Okay. And can I get you to clench your jaw for me? Can I get you to give me a big smile? Puff out your cheeks. Okay, can you say ah and open? Good, that's good. Can I get you to raise your eyebrows? Okay, stick your tongue out and move it left to right. Okay, and can I get you to shrug your shoulders for me? Look left and look right. Okay, cranial nerve 8 is intact because the patient's following my commands. Can I get you to squeeze my hands for me? Good. Okay, can I get you to raise your arms up with palms facing forwards and close your eyes? Okay, there's no pronator drift, so that's good. So, there's no neurological deficits, cranial nerves are intact, fast test is negative. So have you got any allergies, Jess?
No, not that enough.
Okay, are you on any regular medications?
No, but I took some ibuprofen just 2 minutes ago.
Okay, and how much, do you know the dose of your ibuprofen?
400 milligrams, I think.
Okay, so it's 2 tablets, that's good. And are you taking any anticoagulants such as warfarin?
No.
Okay, and do you have any medical problems apart from migraines?
No.
Is there a chance that you might be pregnant?
No.
Have you got a history of an intracranial bleed?
No.
Have you got a family history of stroke or cerebrovascular abnormalities?
No.
Have you been well recently?
Yeah.
Okay. Have you lost consciousness at any point during the headache? No. Okay. So looking at her vital signs and from an assessment, I believe that you're having a recurrent episode of your migraine. So at this stage, I'd like to give you some pain relief. So because you've already had ibuprofen, I'm going to withhold that and I'll be giving paracetamol. So I've got paracetamol, which is an oral analgesia. It's going to help relieve some of that pain you're feeling from your migraine. So can you tell me your weight, please?
65.
65, okay. So I'm going to let my officer drug check that this is paracetamol, okay? And so some side effects of paracetamol is nausea and vomiting. It takes about 30 to 60 minutes to work, okay? So at 65 kilos, I'll be giving 2 tablets or 1 gram of paracetamol, okay? So I'm going to be documenting the time that was given it. I'll be withholding opiates as well for the pain, and I'll be giving normal salines instead because it's been proven to be more effective in treating migraine because it directly prevents the overstimulation of cells, and it is also outlined in the clinical practice guidelines for the treatment of migraine. So this will be given intravenously at up to a maximum of 1 liter. How you've presented. Your migraine, does it feel different from other episodes of your migraine?
No.
At this stage, Jess doesn't need transport to hospital and her symptoms can be managed in the house. So I'm just going to make sure that there are no red flags present, and I'm going to be referring to my checklist. You don't have any headache or neck pain following neck manipulation. You don't have any neck pain or neck stiffness. This onset of headache wasn't sudden. Her temperature was less than 37.5. She doesn't have persistent vomiting. There's no focal neurological signs, and she didn't have an altered level of consciousness or a history of altered level of consciousness with the onset of her headache. She didn't have any trauma before the headache started. She's not taking any anticoagulants or has a known bleeding disorder. She has no signs of temporal arteritis. She's not hypertensive or is pregnant and doesn't have a history of intracranial bleeding. She doesn't have a family history of cerebrovascular abnormalities, and the onset of her headache was not
during sexual activity.
Before I leave her at home, I just have to explain, I'll be giving her some health promotional tips that can help with her migraine. So some things that can help is to rest in a calm, quiet, dark room. So this is to reduce as much stimuli as possible, which can worsen your migraine. Another thing you can do is also avoid triggers, such as things that you know that bring on your migraine, and try and keep yourself as safe as possible when you have these episodes. For example, if you're driving to pull to the side, because she's got no red flags, she can be safely left at home. So Jess, if your symptoms don't improve, you can see your GP. And with your medication, you can continue taking your ibuprofen and paracetamol regular time intervals, and I'll tell you more about that later. As I'm not transporting Jess to hospital, I'll be referring to my non-transport checklist to ensure that Jess is left at home safely. So the patient has been fully assessed, including a set of vitals and appropriate investigations. None of her vital signs were abnormal. She's got no serious injury or illnesses, and if any potential ones have been excluded. She had no red flags present in the headache section. Okay, Jess, could you just walk to the door and back for me? I'm just checking to see whether she mobilizes well.
Yeah.
She's been given information on when to seek help as well, and a PRF would be left with the patient and how to access it.